Welcome to this video entitled, Pharmacotherapy of Asthma, Common Cold, and Other Pulmonary Disorders. Nathan is a 12-year-old boy with a history of asthma, diagnosed 2 years ago. He is outgoing and active and participates in a swim club and a basketball team, but he has had a difficult time adjusting to the limitations of his asthma. He has learned to control acute attacks by using an salbutamol, marketed as Ventolin, metered dose inhaler, and because his asthma is often triggered by exercise, he has also been using a budesonide, marketed as Pulmicort, inhaler and taking Montelukast, marketed as Singulair. After competing in a swim meet at the local indoor pool, Nathan began experiencing respiratory distress. He alerted his coach, who retrieved the salbutamol inhaler from Nathan's backpack. After 2 inhalations, Nathan was still in distress and the rescue squad was called. On admission to the emergency department, Nathan is in obvious distress with pulse oximeter readings of 90% to 91%. He has nasal flaring, bilateral wheezing is heard in his lung fields. His pulse rate is 122 beats per minute, and he is orthopneic. While treatment is started, the nurse asks him questions that he can nod or shake his head to answer. He shakes his head, no, when asked if he used his budesonide inhaler today and shrugs when asked about his last dose of Montelukast. Question 1 reads, considering his history, medications, and the location where Nathan's asthma attack occurred, what might explain his acute attack? Nathan's acute asthma attack began after competing in a swim meet in an indoor pool. Potential triggers for the attack include exercise, inhaled chlorine or other substances from the pool, and the possibility of molds or other allergens in the indoor air. Nathan admits to missing his budesonide, marketed as Pulmicort, dose and is not sure about the Montelukast, marketed as Singulair. The absence of these preventative medications may also have factored into his acute attack. Question 2 reads, what medications would you anticipate will be prescribed to treat Nathan's acute asthmatic attack and why? Nathan will be given oxygen therapy, and a nebulizer treatment with salbutamol, marketed as Ventolin, or other quick-acting beta agonist may also be used. If these fail to abort the attack, Nathan may require more aggressive therapy with epinephrine, marketed as adrenaline, or isoprotronol, marketed as Isuprel, both of which are adrenergic drugs used to achieve rapid bronchodilation. Question 3 reads, what changes might be made to Nathan's medications? What teaching will Nathan and his family need prior to discharge? Because Nathan had forgotten to use his budesonide preventive inhaler and was not sure about taking the Montelukast, the nurse should explore the need for methods to remind Nathan to take his medications if this is a routine problem. Involving Nathan and his family in determining strategies will help to ensure adherence. A long-acting beta agonist inhaler such as salmeterol, marketed as Serevent, may be added to the routine to provide longer-term bronchodilation. Because allergens may have triggered the asthma attack, the provider may want to test Nathan for allergies. If allergy testing is ordered, the nurse will need to teach the rationale behind and methods used for the testing and check with the provider regarding any changes to Nathan's current drug regimen before testing is started. A short-term administration of oral corticosteroids may also be needed to reduce the inflammation from Nathan's recent attack. If changes to his other medications do not achieve the desired results, omalizumab, marketed as Xolair, may be added to Nathan's routine. Since omalizumab is given subcutaneously, It may be less desirable than inhalers or oral drugs and may be considered only if the other options have not had the desirable outcome. We will now progress to the MCQs. Question 1 reads: a client with asthma asks which of the prescribed medications should be used in the event of an acute episode of bronchospasm. The nurse will instruct the client to use a salbutamol, a beta-agonist bronchodilator, by inhalation. Or B. beclomethasone, a glucocorticoid anti-inflammatory drug, by inhalation. Or C. ipratropium, an anticholinergic bronchodilator, by inhalation. Or is it D. zafirlukast, a leukotriene modifier, by mouth? The correct answer is A. And the rationale is: a quick-acting inhaled beta-agonist such as salbutamol, marketed as Ventolin, is used to abort bronchospasm. Options B, C, and D are incorrect. Beclomethasone, marketed as QVAR, ipratropium, marketed as Atrovent, and zafirlukast, marketed as Accolate, are drugs used to prevent and control bronchospastic attacks and will not cause bronchodilation quickly enough to abort an attack. Question 2 reads: a client is prescribed beclomethasone, marketed as QVAR, a glucocorticoid inhaler. Education by the nurse will include the instruction A. Check your heart rate, because this may cause tachycardia. Or B. Limit your coffee intake while on this drug. Or C. Rinse your mouth out well after each use. Or is it D. You may feel shaky and nervous after using this drug? The correct answer is C, and the rationale is: corticosteroids can decrease the beneficial oral flora that will allow for an overgrowth of fungal infections such as Candida. Rinsing the mouth removes any corticosteroid drug deposited there and prevents it from being swallowed, decreasing the likelihood of systemic absorption. Options A, B, and D are incorrect. Inhaled corticosteroids such as beclomethasone do not cause tachycardia, nervousness, or tremors, and caffeine does not need to be avoided while the drug is used. Question 3 reads: the nurse should inform the client who is prescribed a nebulizer treatment with salbutamol, marketed as Ventolin, that a common adverse effect is an increased heart rate with palpitations. Or B. a predisposition to infection. Or C. sedation. Or D. temporary dyspnea. The correct answer is A, and the rationale is: bronchodilators such as salbutamol may have an adverse effect on heart rate elevation and palpitations related to dosage. Options B, C, and D are incorrect. Bronchodilators do not decrease the immune response or increase alertness. While some bronchodilators have been known to cause unexpected problems and paradoxical bronchospasm, this is uncommon. Question 4 reads: the nurse should monitor a client who is taking beclomethasone, marketed as QVAR, for evidence of select all that apply. Is it A. infection, or B. hyperglycemia, or C. urinary retention, or D. tachycardia, or is it E. photophobia? The correct answers are A and B, and the rationale is: because corticosteroids such as beclomethasone decrease the immune response, the risk for infections is increased. Corticosteroids also increase blood glucose, thus increasing the possibility of hyperglycemia. Options C, D, and E are incorrect. Corticosteroids do not cause urinary retention, do not increase the likelihood of tachycardia, and do not cause photophobia. Question 5 reads: Despite repeated demonstrations of proper inhaler use by the nurse, a client is unable to demonstrate proper technique in using the training inhaler. The client is becoming frustrated. What is the best action for the nurse to take? Is it A. Encourage the client to keep practicing just a little longer? Or B. Notify the healthcare provider that the client is incompetent? Or C. Provide a spacer for use with the metered dose inhaler? Or is it D. Switch to an oral form of a beta agonist? The correct answer is C, and the rationale is: some clients have difficulty mastering the coordination between inhalation and activation of the medication. In these instances, a spacer will hold the medication cloud so that this is not a concern. The spacer has additional advantages because it results in more effective delivery of the drug to the site of action and less drug deposition in the mouth and oropharynx. However, note that spacers are only available for use with metered dose inhalers. Options A, B, and D are incorrect. Additional practice may help in the long term, but it is not the priority for an immediate solution to the problem and may only serve to frustrate the client further. The healthcare provider would not need to be contacted because the client has difficulty learning, provided that a solution is readily available. Substitution of an oral form of the drug is not within the nursing scope of practice. Thank you.